Do you frequently feel like your heart aches sometimes, not physically, but emotionally? Like one week you're full of energy, starting new projects, barely sleeping, but still feeling great. And then suddenly you're stuck in bed, can't focus, feel worthless, and don't want to talk to anyone. If this sounds familiar, you might be experiencing something called bipolar II disorder. It's not just mood swings like when you're upset because your coffee got cold. This is more intense. People with bipolar II go through highs, called hypomania, that feel exciting but aren't full-blown mania, and then deep lows, depression, that can last weeks or months. Imagine riding a roller coaster you didn't agree to. Sometimes you're laughing at the speed, other times you're terrified and just want to get off. That's the reality for many with this condition. So what causes bipolar II? It's not just stress or bad choices. Think of your brain like a phone. Some people are born with an app that's pre-installed but glitchy. That app could be your mood regulator. If your parent or sibling has bipolar disorder, you're more likely to have that glitch too. That's genetics. But genes aren't the only thing. Brain chemistry matters. Imagine your brain uses messengers called neurotransmitters like serotonin and dopamine to say calm down or feel happy. In bipolar II, these messengers don't work right. Sometimes they shout too loud during hypomania. Sometimes they go silent during depression. Trauma like losing someone or being in an abusive relationship can also turn on the glitch. So it's a mix. You're wiring your chemistry, and your life events all play a part. Let's play a quick game. Raise your hand if you've ever stayed up all night excited about a new idea, felt super confident, talked fast, and didn't feel tired. Now keep your hand up if a few days later that same energy vanished, and you felt drained, cried easily, and avoided your friends. If you did, that could be a sign of bipolar II. The highs, hypomania, aren't as extreme as full mania, so you might think, this is just me being productive. But then come the crashes, deep sadness, no motivation, trouble sleeping or sleeping too much. Unlike regular sadness, this can make it hard to work or study. People might say just cheer up, but it's not that easy. One person might start a YouTube channel, post 10 videos in 2 days, then delete everything and stop leaving their room for a week. That cycle up then way down is the main symptom. How do doctors find out if someone has bipolar II? There's no blood test. Instead, it's like being a detective. A doctor will ask questions like, when you feel super high, do you sleep less but still have energy? Have you ever had a depressive episode lasting more than a week? They might ask your family too, because during hypomania, you may not realize you're acting differently. Diagnosis takes time because it's often mistaken for regular depression, since the lows are more obvious. But treating only the depression without managing the highs can make things worse. Treatment usually includes mood stabilizers like lithium or other medications, plus therapy. Cognitive behavioral therapy, CBT, helps you notice warning signs like when you start talking too fast or skip sleep, so you can act early. Regular routines like going to bed and waking up at the same time also help keep mood swings in check. Can you prevent bipolar II? If you're born with the brain chemistry and family history, you can't avoid it like catching a cold. But you can prevent the episodes from being as bad or frequent. Think of it like managing diabetes. You can't cure it, but you can control it. For bipolar II, that means sticking to your meds even when you feel fine. Keeping a mood journal, like a daily emoji check-in, smiley face, neutral face, frowning face. Avoiding drugs and alcohol, they can trigger swings. And building a support team, someone you trust who can say, hey, you're talking really fast again, are you sleeping okay? Early action during warning signs can prevent a full episode. Regular sleep, exercise, and avoiding extreme stress help too. It's about balance, not perfection. Scientists are always learning more. One new area is using smartwatches or apps to track mood, sleep, and activity. Imagine your watch notices you're talking fast and sleeping only 4 hours. It could send a gentle alert, check in with yourself, mood shift possible. Another advance is rapid-acting treatments. Ketamine, a medicine once only used as anesthesia, is now being studied to treat severe depressive episodes in bipolar 2, sometimes working in hours, not weeks. Researchers are also looking into how inflammation in the brain might play a role, which could lead to new medicines. And therapy apps with AI coaches are being tested to give daily support. While there's no cure yet, these advances make managing bipolar 2 more precise and personal than ever before.